Hi Nick, thanks for spending some time with me today, answering some questions from our patients about virtual health.
Thanks, Sam. It's very topical thing at the moment. Obviously, most of us are doing video consultations, both physios and surgeons, and we get lots of queries and questions from patients. So hopefully, we could answer some of them today. Okay. Well, a lot of stuff I see in my clinics as a shoulder surgeon is it the neck or is it the shoulder? Sometimes it's both. And I think that a lot of the time, uh, neck and shoulder pain is helped by physiotherapy, regardless of whether some of the problems triggering it require surgery. Almost all of the physiotherapy that's evidence-based is exercise-based physiotherapy, so that could definitely be done by a virtual consultation. What do you think?
Yeah, certainly I agree. So I think a lot of us are creating a lot of tension in our shoulders and neck at the moment with our working situations changed. But it's really easy from a physio perspective to have that online consultation, have a look at how you're moving and posturing things and give advice and give some exercises. And in terms of long-term consequences, I think if we don't address sort of posture and movement and neck pain, don't Google it in case you're going down the wrong path. I think it's worth asking that question.
I agree. I think leaving things until after lockdown is quite a tricky one. One, we don't know when lockdown's going to end. Two, you don't know. You might have a suspicion or a thought of what your problem might be, but you don't really know whether it's something simple or something sinister. And then there's the quality of life thing of just struggling on through what already is a stressful period. And we are here and able to help patients. Physiotherapists and surgeons have been busy helping patients throughout this period. So don't leave it, especially because it could be something urgent and you just don't know. As a surgeon, I've had to adapt how I work through my diagnosis when I'm working in the virtual world. Some things have stayed the same, but some have had to change. I'd say that firstly, I don't diagnose a patient just by examining them. We take a history, we find out the symptoms, how they presented, what triggered them, what aggravates them, what treatments have been done so far, what are the medical problems the patients might have which might affect that condition. And that gives me usually a list of possibilities. And then I sort out investigations to try to confirm that diagnosis and make sure nothing else is going on as well. And virtually, I can definitely take your history. I've had to adapt how we examine patients virtually, and I think that video is a lot better than a telephone consultation because I could see how the shoulder moves. I can do some tests of strength. I can do some of our shoulders special tests. There's not everything we can do virtually in terms of clinical examination, but I can certainly get a range of diagnoses and order investigations. And then if it's something that I could not examine properly via video, I could always bring the patient in for one face-to-face consultation to examine them.
Yeah, and I'd echo that with physio as well. So we would do our clinical examination and our history taking. So all of the history of how it started, what makes it worse, does it get better, does it bother you at night, activities, all of these things, and describing the pain and pointing to it, give us that pattern. It helps us with the diagnosis from there. And as physiotherapists, when we do our examination, we'll form a hypothesis. If we're not happy that that's exactly the right direction, or they don't resolve, or we can't create change quite quickly, then one of the first and earliest things we'll do is refer to a surgeon. So we've got that opportunity to escalate really quickly. So I'd be sending it to you going, I'm not sure if I'm on the right track, can you confirm that, and bounce it back. So you almost get that kind of double reassurance that second question is being answered. So if we can't change it quickly, we've got a pathway to go to.
Yeah,
Sorry, go ahead.
the same thing as a surgeon. Not everything that I see needs surgery. In fact, for shoulder and elbow, probably only about 10% of the complaints I see need surgery. But what often helps the patient and how I'm able to contribute to the pathway is to get them that right diagnosis and then discuss with them all the treatment options, including non-operative treatment. But usually they're to support physiotherapy because almost everything needs physiotherapy. And in shoulder and elbow surgery, every operation I do needs physiotherapy after. There's not a
Mhm.
single one. So we work quite closely together as a result, physiotherapists and shoulder surgeons. Yeah, so I have had to, as I say, operate on a few people during lockdown, and there were even some patients who got operated on the week before lockdown, and I had to deal with their post-operative care afterwards.
Mhm.
Um, uh, their post-operative care hasn't changed because of lockdown or because of needing virtual treatment. We've been able to do things like removing sutures and inspecting their wounds over video, talking the patients through it and getting their partners or family to help them with that. We, as I said to you before, all patients who have surgery will need physio, but they don't need face-to-face physio. And in fact, I actually prefer virtual physio because some shoulder conditions, and certainly a lot of elbow conditions, when we operate on them, I don't want manual therapy. There, by that I mean someone pressing on their arm or stretching their arm, trying to force movement early on, because that can actually cause more problems and more pain, more muscle spasm, etc. So simple exercise therapy usually is all you need post-op.
Yeah, that's certainly what we would look to do. So post-op shoulders, naturally they're sore. We won't want to be pressing on them, causing any more trouble. And the physiotherapy course of action tends to be about getting normal movement back, which we can see, we can guide you through, make sure that the posture looks okay and that the exercise is being executed well, and then gradually build them up in time at home. So a lot of post-op, even if you were to come and see me in clinic, is me giving you instructions of gentle watching your pain management over the next few days, and we'll gradually build those up. So it's more of a to-do list at home rather than a me doing anything to the patient and guiding them through that process, which is completely doable
And
online.
that's
It's no different really.
I totally agree, and I use an analogy. As you know, I've done a blog about physiotherapy on my website, and I use the analogy that physiotherapy is like a drug. The patient has to take it, and you, as the physiotherapist, prescribe the drug. You tell them which exercises to do. You monitor their use of the drug. You check to see, are they taking it right? Are they taking the right dose? And then you adjust the drug. Do you need to scale things up? Scale things down if they've got pain and aggravation of their symptoms, etc. But ultimately, they've got to go away and take the drug.
And certainly the benefits that I found of virtual, particularly for post-op shoulders or guiding people, is that if they wish to see someone sooner, so if you're in normally a busy clinic and you have that date booked in the diary, it's much easier to see people sooner if they have a question or something comes up or they're a bit more sore or they don't understand an exercise. It's so much easier and more convenient to review. And if you've got someone whose arm's out, getting bus or public transport is quite a nerve-wracking thing. So being able to do that at home really appeals.
Well, I alluded to it earlier that a lot of the stuff that we see as shoulder surgeons don't require surgery. Even though there's currently a lockdown going on, we are able to operate on emergency conditions. So if you've got a severe injury or a sinister problem, cancers, things like that, those operations are going ahead and we are able to operate on patients. Secondly, at some point, lockdowns will be lifted and we will get back to operating on routine stuff. But all the routine patients during the lockdown period are currently in a queue. And I think that the longer you leave uh, your problem, the further back in that queue you're going to end up being if you do turn out to need surgery.
Yeah.
But if you need surgery and it's not going to be for a few weeks or a few months, physiotherapy can help with pain management strategies to help give you some good quality of life while you wait for your operation. There's medications we can prescribe to help with pain while you wait for that operation. So
Yeah.
my message to patients will be, don't suffer in silence just because we can't do routine operating at the moment.
Yeah, and I would say an important point of physio for that is that post physio, post surgery anyway, we often look at movement patterns. So the longer someone is sore, the longer they're suffering in the community with a problem and they leave it without any physio guidance, you start to move in kind of cranky, unhelpful movement patterns that can actually make you more sore. And the earlier we can tap into that movement and settle it down and create less pain and get you do normal things and prehab and strength prior to the operation, the much more success we see subjectively on the other side. So they're going in well educated with a bunch of stuff to do, come out much quicker the other side.
One of the most common things we see is that scapular protraction, where people sort of hunch forward to protect themselves from pain. They then start to get pain in the rhomboids, the muscles at the back of the shoulder blade, and pain in the trapezius up the neck. And they can't understand, well, if my problem's in my shoulder, why is my neck hurting? And all those natural adaptations could be corrected by physiotherapy in the meantime while they wait for their surgery. Some physiotherapists have training and specialization in strength and conditioning. So beyond rehabbing somebody from an injury, they can help people attain those goals in terms of sport and fitness and give a bit of advice around that. So it's a sort of step between a physiotherapist and a personal trainer / coach, where you keeping in mind their injury or shoulder problem that they might have and their desire to get back to sport. And once the injury is treated, you kind of build their fitness up and start getting them doing sport specific exercises in preparation for that return to sport. And all of that could be done in this period. So it shouldn't be lost time.
Yeah, absolutely. I think from the physio side, we're seeing people either reducing their activity, their shoulder activity, so our swimmers are unable to swim and
Yeah.
they're experiencing pain because they're not using their shoulder so much, or they've altered how they're training. And they're worried about re-injuring and needing to come to see somebody later on when they get back to full health. So we are definitely doing lots of advice in the community about tendinopathies and how to gradually load, how to modify exercises at home for your sport, and then gradually build that loading back up and what to expect. So yeah, there's loads of things we can do there to prevent injury and chat. So you don't necessarily have to have something to come and talk to us if you're concerned about getting back, particularly if you get back to a really high level. But saying that, quality of life, if you're starting a new sport, tennis is going to be the new thing that everyone's having a go at. If you get tennis shoulder, come and talk to us before it gets too worse if you haven't played since school.
That's the thing, is that a lot of what we do in healthcare, be it physio, surgeons, medical doctors, etc., a lot of it is advice and guidance. Sometimes patients just need, a few questions answered. They don't often need a specific treatment. They just need advice on how they can self-manage. It's an important role for us. And I think I've certainly seen physiotherapists excelling at this during lockdown with all sorts of advice to keep people active and prevent injuries and problems. So you guys have been doing a great job on that, really.
Okay, I think that's all the questions that have come through. There was another one about other areas, and I think similarly, the queries that people ask about other joints, so back, knee pain, virtually, those are going to be addressed in other places. It's a conversation for another day. But I think the key point that we've picked up here is that physio and surgeons can treat lots of stuff virtually, and it's worth a question. And don't suffer in silence. Don't wait.
Yeah, we're here to help. We've adapted how we work to make things as efficient as possible. My virtual consultations provide almost the exact experience that patients would have got in clinic, other than a slightly altered clinical examination. We still get clinic letters. You still get your prescriptions, etc. We've really adapted how we deliver healthcare to make sure we can do it remotely. So I would say, yeah, don't struggle at home thinking that you have to wait until you can see us face to face. There's a lot we can get done in the meantime.
Yeah, and we'll echo that in terms of physiotherapy. We are open to emergency appointments that are being triaged appropriately, but we're doing lots of virtual appointments and making lots of people feel better and boosting them in the community. And it gives people that freedom of decision as to whether they think it would be appropriate to see someone and not have to wait. The saying "wait till lockdown is over" doesn't have to be a conversation to have. You can get help now. Well, thanks for your time today, Nick.
No problem. Thanks for having me on and for getting us all these great questions. They did cover quite a range of the stuff that we get asked in clinic and that we've been asked over the past few weeks. So it's been very useful.
Okay. And if anyone would like any further information or queries or questions, just contact one of us. We are always happy to help. So please do get in touch.
I'm on @ShoulderLondon on Instagram, Twitter, and Facebook. I have a YouTube channel which you can Google me, and my website is www.shoulderandelbowlondon.com.
Brilliant, thanks Nick. And I'm at APPI Clinics. We are the APPI Physiotherapy and Pilates Institute based in Hampstead and Wimbledon. And I'm also at Samantha Physio. If anyone wants to ask me any particular questions, please do go ahead. Thank you. Thanks, Nick.